Hi folks, Dr. Z here. I wanted to give you an idea of what a denture looks like and what it would look like to convert that to an all-on-4, which is basically the denture with 4 connections to 4 implants that are permanently fixed into the jaw. So with a denture, you're essentially looking at retention from the way that this adapts to your gums and the way that these flanges form a tight seal around the edges into your vestibules or the outside areas of your gums. So this really depends on saliva and moisture to have a nice tight seal. There's a surface tension, and then there's also a suction that needs to happen for this to seal onto your gums. And this is a great starting point where we can kind of see where your teeth are. We'll understand how your function works. But for many people, this is very uncomfortable because one, you have to cover the entire palate on the top, and there are some very important taste buds. There's a sense of temperature. There are sometimes it's just a very sensitive area where people find that they gag very easily when this is adapted or touching the palate. So if possible, and if you're healthy enough, what we'd like to do is cut out all of this material and essentially be left with this. This is basically a set of teeth that now you are back into a natural arc where you don't have anything touching your palate. You can taste better. It's way more comfortable, and it's fixed basically permanently onto your gums. So once that goes on, it's screwed in with 4 tiny screws, and I'll show you these screws. They're very, very small. You're essentially taking a screw, 4 of these, tiny guys. That's the screw right there. So this goes in 4 times, and maybe once or twice a year, once a year, maybe once every other year, we go in and we take these screws and we unscrew them. We turn this over, we clean the underneath, we flush out around your implants, and that's a maintenance. That's not bad to do. We replace those screws because you can see how small they are. Those can take some beating, especially when you function normally and eat. So I hope that helps. This is the denture, and then this is converted, or it can be cut out, and the same one can be used to be put onto the 4 implants. That's called a conversion. This can also be made of different material. So this happens to be an acrylic, but you could make it in a resin. You can make this in a zirconia or have it all porcelain. You can have this have a metal bar inside, which is kind of the standard. You have a titanium bar where the acrylic is placed over it. But there are many different types of materials, and there's different indications or different places where each one of those can be used and should be used. So I hope that helps, and I'll also give you a little bit of a chart so you can see what the materials are and what the pros and cons of those are, and that'll kind of help you make a decision what's best for your health and what's best for your overall function. So have a wonderful day. Talk to you soon. Bye.